All right, so here we are again on day 3, and we have such a great pleasure to have Dr. Cohen join us. She's going to talk to us about eye health. I myself got not the greatest vision. I wear contacts and glasses, but Dr. Cohen, she's going to share with us what she's noticed in her African-American clients and patients as far as eye care, as far as whatever illnesses or what have you that we have with our eyes. And then also give us some tidbits on what we can do to improve upon our eye care. I messed that all up, but go ahead, Dr. Cohen. Oh.
All good. Thank you so much, for having me. I am Dr. Camille Cohen. I am based here in Brooklyn, New York. I have a private practice within a franchise office that I co-own with my family. I've had past experience in private, also retail hospital practices, having worked predominantly for many years in a Black or Afro-Caribbean community. There are certain things that I've always noticed with patients and doing community service events, whether here or abroad. There are certain things that always stand out with the patients, and that would be really the lack of, which we touched on, the lack of trust with healthcare professionals and being able to relate to them, being of Caribbean background, understanding certain dialects, understanding certain herbal remedies that are used, and knowing that in my background, knowing what my family would use, being able to relate to them and explain things properly, I think that gains a certain level of trust. I mentioned to you earlier that for me, having just done extra research recently to better understand the mistrust, because it comes in waves. Even getting in the past people to come to service events has been difficult because they don't want to, a lot of times they don't know who is going to be servicing, so they never think that I'm actually the doctor that's doing it. Then the next thing would be, I don't want to hear bad news, and I don't want to have to stop eating the way I've been eating my whole life, because a lot of that is tied to our culture. And so if you've been eating one way and now it starts to affect your body and your overall health, it's really hard to break those patterns, right? And so trying to educate them on that you can still maintain your culture. I'm very proud of my culture and very proud of the food I eat, but understanding that maybe how we were raised to certain portion sizes that we were raised on shouldn't necessarily carry with us throughout our lifetime, or just how we relate to the difference of culture being, and I'm speaking again specifically to the Afro-Caribbean community, but I would say across the board, because even for African Americans moving from the South, coming up north, being in New York, you might find that in the past we were more active in that we walked more, walked from one destination to the next. Whereas here, well, New York, you walk, right? But you can catch the bus, you can get on the subway. Nowadays, you can Uber, you can Lyft, as opposed to walking. And we really take that for granted as how that relates to our health. So bringing up all of this, we have to look at a few things. It being Black History Month, I think something that's really important that I've been reading up upon is just that we've been in the Americas since about 1619. And from that time, there were physicians that examined our bodies, but we were property. So we're really being examined as you would examine cattle. And those same doctors may perform experiments or treat us as an entity and not a person. So you have really the basis of mistrust from the time of slavery that carries to present day. And I think that that's really important to break that cycle by beginning with how we take care of our own bodies. Ocular health is systemic health and vice versa. So if you're not well in the body, you're not going to be well in the eyes. The eyes help us to see, but we tend to think of that as just a glasses or contact lens exam. That is the very basic level of an exam. Then that really does not contribute to the true health of your ocular or visual pathway. How you take care of your blood vessels, meaning how you manage your high blood pressure, your diabetes, your cholesterol, that has a direct link to how you see. The National Optometric Association seeks to advance the visual health of minority populations. That's what that organization does. Their program, the 3 Silent Killers, focuses on the 3 top ailments that affect the Afro and Afro-American community. And that would be high blood pressure, diabetes, and glaucoma. So again, going into that, that goes back to what I started with, systemic health. If our blood sugar isn't under control, if our high blood pressure isn't under control, then you are more likely to have vision loss. Right now, diabetes is the #1 cause of blindness in this country. 34 million Americans suffer from diabetes, and at least 7 million aren't even aware that they have diabetes. Diabetes is really a conveyor belt. Your blood vessels are a conveyor belt from the whole body to the eyes. So if that blood has too much sugar in it, it's not processing the sugar properly, right? Then it gets thick. That blood starts to leak out because it can't flow through that blood vessel. There's a lot of leaking that can occur in the eyes, which would be hemorrhaging or bleeding in the eyes, which would take away your vision permanently. So when you hear about diabetics losing vision, that's usually a main cause. Similarly with blood pressure, 40% of African Americans have high blood pressure. And this is a silent thief of sight as well as life, because a lot of times we don't have symptoms when we have high blood pressure, right? And aside from COVID taking over cardiovascular disease, for a long time, cardiovascular disease has been the #1 killer for Americans, right? And much more so prevalent in the Black community. With glaucoma, we're dealing with the optic nerve. So these are extension cords that go right from the eye all the way to the brain. And that provides visual information, more specifically your side vision information, to the brain so that we can process what we see. And similar to blood pressure, but not directly correlated, you may not have any symptoms with this. There's a plumbing system of fluid in the back of the eyes, not something that you would be in charge of, you would do, that sometimes gets backed up, and that fluid can basically start to compress the nerve and kill the nerve tissue, which we can't at this time regenerate nerve tissue. How that relates to our vision, we slowly lose side vision, and then it comes in and takes away eventually our central vision. This is really crucial because if someone comes in complaining about glaucoma, usually that's too late, because again, it takes away side vision. So we'd want to catch it when it's way out in the periphery before it affects your central vision. If this goes unchecked, then by the time it's starting to affect your central vision, there's really little we can do to preserve the vision. You're much more likely to lose the vision permanently. Right now, there are huge advances as far as surgical intervention, as well as drops that can be used to help slow down the loss of vision. So when we come in with this mistrust and are reluctant to get checked or participate in preventative care, we're really opening the door for a host of issues that can be detrimental not only to our vision, but our whole lives, right? When you think about this, even with high blood pressure, remember the blood vessels, it's one long conveyor belt to the whole body, to the eyes. You can have a stroke of the eyes. You can have a lack of blood flow because that blood flow isn't flowing correctly because the pressure is too high, and you can lose vision that way. It can be an early sign of a stroke. Many people do not know that your vision will give you a cue to your overall health. You may have an episodic blurriness in vision or a darkening of vision. That is a transient ischemic attack. That is a mini stroke. And a lot of times I've had patients who have a full-blown stroke, and when I question them, they had several TIAs before the full-blown stroke. So all of these things are reasons why we really have to at first take accountability for our own health and be prepared to, walk more, participate in more cardiovascular exercises, change how we eat. And that can be really difficult because we emotionally tie ourselves to food. And I don't believe in deprivation, but truly just restructuring how we think about the food we eat and our portion sizes, and really limiting sugars, and junk food in general, all of the things that would contribute to a higher blood pressure, higher cholesterol, and diabetes.
Wow. That's all I can say was like, wow. I was like, oh my goodness. What can I do to avoid blindness and losing my vision? because I know you mentioned walking and our foods, but is there anything else that I can do? Because I tell you one thing, you got me scared straight. Holla. Okay, I was like, oh my goodness. I'm talking about a scared straight talk. That was me. I was like, wow, what can I or anybody who is watching do just to
Right.
ensure? Yeah, what else?
Well, I think knowing family history, that's a really big one. I always start by, it's one of the first things I ask a new patient, hey, is there a family history of vision loss? And a lot of times people say, I don't know, I don't think so. No, I'm sure we're fine. And we attribute it to, well, that person was old when they lost vision. Okay, what does that mean exactly? Do you know why they lost that vision? Have you looked into it? Maybe they had possibly glaucoma or macular degeneration. There's so many eye conditions they may have had for decades that went untreated, and then they lost vision. And we are living longer. So what you had in your mind growing up as old may be a very functional age for you when you approach that age, right? So learning, hey, why did so-and-so lose their vision in older age? Or, hey, what is our family history? What is our health history? What do you have? Having those conversations, especially with what we call first-degree relatives, which would be your parents and your siblings, knowing what they have has a direct effect on you, because a lot of conditions run in families, right? So that's one, knowing your family history. I think two, what we talked about, taking care of your health, making sure you're exercising and eating well, making sure that you're participating in preventative care. We may have these fears of going to the doctor or getting bad news, but really preventative care is preventing the worst news, right? So that would be going in for your annual eye exam, going in for your annual exam with your primary care physician, making sure you're following up with your dentist, all your routine exams that really help to catch an ailment before it becomes serious. We know that many things, if you think about even colorectal cancer, right? Take that for example. The literature says, you know, when you're 50, but really in the African-American community, we should be doing that in our 40s. I would say the same for glaucoma. A lot of the literature may look at it like, oh, your early 50s, mid 50s, start doing the more extensive testing for glaucoma. Well, I know that from my Black patients, I'm more likely to see early signs of glaucoma as early as their 30s. So you want to be making sure, especially if it runs in the family, that you're not just doing your routine eye exam, that you're getting the most comprehensive exam. There are great advances in technology over the last few decades. We can do a scan of the nerve that allows us to see all the layers of the tissue, to check the integrity of the tissue, to see, is it being affected by glaucoma? We can look at the blood vessels and scan that more closely to see, hey, do you possibly have early diabetes or uncontrolled blood pressure? Because again, like we mentioned, a lot of these things come without signs or symptoms. So you feel fine and you're still seeing okay. And you say, oh, I'm fine, I don't have any, I'm not taking any medication. Okay, well, regardless of that, you may still have this ailment and it's just not showing up yet, right? And understanding then the flip of that is, oh, I don't have this because I'm taking this medication. No, you have it. It's being controlled with medication. So those are some of the things that we really need to work on in order to protect vision, right? So making sure that we're taking care of overall health, that we know our family history, that we're doing preventative care, and that we're following up annually with those things.
Wow. Well, I tell you what, Dr. Cohen, I already got my physical schedule for April. I'm gonna go ahead and get some more appointments set up. Let me go ahead and do my eye exam again. Let's go ahead and get that done. Then I'm getting ready to come up. Honey, you, like I said before, you have scared me straight. I tell you what, everyone, you know what, I will admit that I used to be ignorant about, you know, just the whole eye thing. I'm like, okay, well, whatever, you know, I can't see whatever, but I didn't realize the extent of, okay, these are things that you can actually have if you don't take care of your eye health. And so that gives me much more of a greater appreciation for it. And I'll be honest with you, you know, in my family, glaucoma runs.
Okay.
And so, you know, that right there just made me say, wow, you know, and I generally get it done every year, just the exam, but just the person in my family, by the time they were diagnosed with glaucoma, it was so late. And then they're trying to figure out, okay, what what eye doctor do I go to? But because they don't trust anyone outside of their community, it was very hard for them to find someone that would be willing to take care of their eyesight. And so, like you said, it's really important, everyone, that we do preventative care. And even if you have to have a family friend with you to go with you on these appointments, if you're feeling not that trust, just go ahead and do it. You have heard from Dr. Cohen today. She has shared with you the 3 top elements in the African-American community: high blood pressure, diabetes, and glaucoma. This is what can lead to blindness. So please make sure if you're in the New York area, please make sure you click on the link. Make sure you click on the link in the description and reach out to her and get that eye appointment done today. Yes. Thank you so much.
Thank you. Thank you.